Hi friends, in this series of ECG basics, today I will talk about Spodick sign. First is the disclaimer. Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Spodick sign, it refers to downsloping TP segment seen as an early ECG manifestation in approximately 30% of the patients with pericarditis. It is best seen in lead 2 and lateral precordial leads like lead V3 to V6. TP segment is from the end of T wave to the start of P wave. It is a ECG marker of stage 1 pericarditis. It was initially described by David H. Spodick in 1974, but recently it was re-evaluated in 2020 in retrospective analysis, and it was found that it is a sensitive marker for early pericarditis. Clinical importance of Spodick sign is it can help us to differentiate pericarditis from ST elevation MI in many ST elevation MI cases, as it is seen in approximately 30% of the pericarditis, but also it can be seen in 5% of ST elevation MI cases also. So we should always look for downsloping of TP segments in at least 2 or more leads. If it is more than 1 mm, then there are likely chances that Spodick sign is present, and it is best seen in lead 2 and the precordial lead like V3 to V6. So it helps us in differentiating from ST elevation MI. In ST elevation MI, we usually see ST depression and ST elevation in lead 3 greater than lead 2. It means that the heart attack or ST elevation MI may show ST depression, that is, and ST elevation in lead 3 more than lead 2. There may be PR segment depression, which can also help us to confirm pericarditis, but it is less specific. As you know that PR segment depression is there in pericarditis, but it is less specific on its own. This is the ECG which shows acute pericarditis showing sinus tachycardia, widespread concave ST elevation and PR depression in lead 1, 2, 3, AVF and V4 to V6. Reciprocal ST depression and PR elevation in V1 and AVR is also seen, and we can see that Spodick sign positive in lead 2. If I zoom it, you can easily visualize that lead 2 is showing Spodick sign, that is TP segment is downsloping in lead 2. This is another ECG which shows pericarditis with Spodick signs in the precordial leads. Here, if I zoom it, I can see this Spodick sign is positive in V5 and V6. So this Spodick sign is early marker of pericarditis, and it is positive, or it is seen in approximately 30% of the cases of pericarditis and also in 5% cases of ST elevation MI. We should not ignore it. With this, I conclude my today's topic. Mahatma Gandhi has said, the best way to find yourself is to lose yourself in the service of others. Thank you. Keep learning.